What choices are available to you when you are having a planned caesarean birth? This is worth a watch and a say for anyone who's having a planned caesarean birth to have the most positive, personalised experience for you. And even if you're not having a caesarean birth, this is worth watching just in case you have an unplanned caesarean to know what your choices and options are available to you. So the first thing I would recommend is doing hypnobirthing in your pregnancy for a caesarean birth, because when you go into theatre, it's going to be a brand new alien environment to you unless you work in a theatre somewhere or you're used to surgical birth experiences. There's going to be a lot of people around you, usually around about sort of 7 to 10 people on average. The more babies you're having for things like twins maybe, then the more people that you will have on hand. Or if you've got additional complications that they need to prepare for, again, they will have more people around. It's bright, it's a really bright experience. So having that hypnobirthing, having the skills to be able to visualise, to be able to have those breathing techniques, means that when you walk into theatre and you go, oh my word, this is quite different. It means that you've got your partner who's hopefully taken the course with you, and they'll be able to look you in the eyes while your anaesthetist is sighting your spinal, be able to keep you calm and relaxed, so that way you're going into the caesarean with a much lower heart rate, feeling more comfortable, feeling more relaxed. You're going to have a much more positive experience from it. And make use of your midwife. The midwife that you meet before you go into theatre, make sure she knows your birth preferences when it comes to a caesarean birth, so have that conversation with her ahead of time. And think about the music that's going on. So music has been shown to lower the anxieties of a woman during a caesarean birth, but also reduce the amount of pain relief she needs postnatally. So it highlights what anxiety actually does to reducing our natural endorphins. And we need our endorphins to really kick in postnatally after a caesarean birth to help us have lower amounts of pain and discomfort after birth. So having that music playing, put together a playlist that's going to make you feel comfortable, happy, maybe a song that you want your baby born to, put that together in the antenatal period. Now, in the actual caesarean birth, you're going to feel lots of sensations like pulling and tugging, and this is where your birthing partner comes in to keep you nice and calm and relaxed, keep those breathing techniques, those visualizations, affirmations, things that you're looking forward to about having a baby in your arms. As for the actual birth of your baby, you have several choices. Now, the first is that baby is just delivered by a caesarean by your obstetrician straight away. The next is to think about gentle caesarean birth. So this is where baby's head is born, but then the baby is gently delivered, so a lot more slowly for the rest of the body. It's far more common with a planned caesarean birth, and what this will do is squeeze the lungs a bit more gently to try and mimic what would happen in a vaginal birth, hopefully expelling a lot of the mucus from the baby's mouth and the nose, and also helping with that transition from going inside your uterus to being outside. Now, if your baby's bum first and breech, or if your baby is in significant distress, then a gentle caesarean birth would not be advised. So this is more for just a planned caesarean birth. Now, the other option to consider is something called a maternally assisted caesarean birth. So you scrub up in your hands, so you have sterile gloves on, and what you do is the baby's head is delivered, then the obstetrician gets you to reach down, and then you pull your baby out and place your baby onto your chest. Now, this isn't available in all hospitals at the moment. It's something that was pioneered out in Australia from a very amazing obstetrician out there. You can Google her, Dr. Natalie, and I will put her links in the chat as well because she's done some fantastic videos on maternally assisted caesareans. But I've heard of a couple of UK hospitals that have facilitated this. This needs an antenatal conversation with your obstetrician before you actually go in for your planned caesarean birth. It isn't something that you can do just at the drop of a hat. This is something that has to be planned for, and lots of the staff members all on board with it prior to that. Now, as standard, all babies, unless they need resuscitation and need help, should have a minute of delayed cord clamping as standard. Now, some areas will facilitate a longer amount of time attached to the cord. The longer your baby's attached to the cord, the better. Some units will enable you to have skin to skin straight away, some do not. It's worth asking the question if this is feasible or possible. And the earlier your baby has skin to skin, the quicker their heart rate, their breathing rate, their temperature can all regulate, also means that earlier bonding opportunity for you. And the one thing that I would recommend to all parents is to have a photo or video taken of their baby being born. Now, even if you think, oh, I'm not really sure, I don't think I'd ever want to see that, have a look at it afterwards and think, actually, I'm going to delete that. I don't want to see that. That's fine. But having that choice, if you can get your midwife to take those photos for you, you will have them there to be able to see at any stage you want. And it's better to have them there than to regret it afterwards that you didn't have those photos taken. And even if you don't want photos of the actual caesarean taking place, what is really lovely is to have those skin-to-skin cuddles in theatre and to get your anaesthetist or your operating department practitioner, so that's the anaesthetic assistant, to be able to take some photos of you skin-to-skin when you are in theatre afterwards. And if you are feeling too unwell to do skin-to-skin because you're feeling really sick, really nauseous from the medication that's given, ask them to give you some medication to help you stop feeling sick as a first part. or ask your partner whether or not they want to do skin to skin in theatre. And the final thing is, does your partner want to cut the rest of the cord? Have you got a cord tie that you might want to use? And do you want your baby immediately weighed to know how big they are and how much they weigh? Or do you want to wait until you get back into theatre? Now, of course, if your baby's really small, if your baby's needing any assistance with breathing, that will potentially have to be done much earlier. But if your baby's come out absolutely fine, healthy, well, no problems, no concerns, you might be able to delay that first checks, the baby on the scales, until you get back into theatre. This will enable you to have that skin to skin for as long as you possibly want to. And if your baby's showing signs that they are hungry, then you might even be able to feed in theatre if you're planning on breastfeeding, or potentially bottle feed in theatre if you're planning on bottle feeding. And then when the caesarean birth is over and you are sat up in bed, think about having that skin to skin when you're being wheeled out of theatre. That way it's you coming out of theatre with your baby just born in your arms. You're the one actually announcing it, showing it off to the world, going back to your recovery area.